Good morning. I'm Dr. Ndaka Mworina, a general practitioner, Advanced Video Laparoscopic Surgical Center, also an oncological center too, at Asokoro, Abuja. The medical term for it will be dyspareunia, painful or pain, and sex. I believe that anyone watching this knows what sex is all about. However, pain during sex is not a good thing. We know pain anywhere is not good. It's not a nice feeling. So now painful sex is a sensation or a discomfort while having sex. It's not actually discussed because a lot of people are uncomfortable or feel ashamed or think people might not understand what is happening. But so far in research, we've realized that at least 8 to 21% of women experience this at some point in their life. There are so many causes. The first will be the entry pain. This is pain when the male partner is about going in. Then we have the deep thrust sensation, the deep thrust pain. This arises when he's already in, but then you feel the pain, like it's as if the pain is deep within, like it's coming from inside of you. The third category is the emotional aspect or the psychological aspect. There are different causes of entry pain. Some structural or anatomical defects, the way the vagina is being formed. Some females have a well-formed vagina, with the clitoris, the labias, and it's a straight canal. But while others have, some incomplete structures. We could even have imperforate hymen. A hymen is a membrane that covers the vaginal opening. Now, the membrane in normal terms is supposed to be a little bit like a thin membrane, so it's supposed to be easy to break through. But in some cases, the membrane is thickened, a vaginismus. Now, this is when the vaginal wall is always, having spasms. It's contracting. It's an involuntary act. Another cause will be not enough lubrication. For women that are postmenopausal, post-delivery, especially within the first 6 weeks after delivery, lactating mothers, because estrogen levels begins to drop. You see, for women below the age of 35-40, the estrogen levels are very high. So they have more lubrication during sexual intercourse. Third point will be injury, following any maybe accident or a pelvic surgery or a vaginal surgery, or maybe even after a procedure. For women that have maybe had kids, maybe a big baby, for example, we have to extend a cut, which is called an episiotomy. So after that, some of them develop pain, and that is why it's always good to give yourself time to heal before going back to sex. Another big branch that women should not ignore is infections. We have from urinary tract infection to bladder infection, which is cystitis, to the vaginal infection itself. How do you know you have an infection? Are you having a discharge? What's the color of your discharge? There are normal discharges you have during ovulation, and then there are discharges you have when you're not ovulating. So now when you start having a lot which has an offensive smell, depending on the color of the discharge, it will determine what kind of infection you have. For urinary tract infection, you're talking about pain while urinating, increased frequency while urinating. On a normal day, you wake up at night to urinate maybe once, which is your regular, and then you realize that suddenly you start waking up at night 3 times, 4 times, then it's actually a problem. So you need to check yourself. Do you have this burning sensation in your clitoris or any of those things? Now we're going to go to the deep thrusting pain. That is pain that is felt when your partner has already crossed the first barrier and now he's inside. Now, most of this could be as a result of deeper issues. Example, cervicitis. After the vaginal canal, we have the cervix. If the cervix is inflamed as a result of infection, you have pain. We also have something we call endometriosis. There is a lining to the uterine wall. It's the endometrium that lines it. Now, when this endometrium begins to grow out of the uterine wall, begins to find its way to the ovary, fallopian tube, yes, pain is possible. We also have the ovarian cysts. When the ovaries are inflamed, because of the pressure of the truss, it will cause pain. There's also uterine fibroid. Now, this aspect, the backbone of most of the problems, because it has to do with the psychology. For a woman to go into sexual intercourse, she has to be prepared mentally and physically. It's not something that you just fling her to the bed and just get it done with. First of all, you have to understand her previous history. Has she been abused before and all of that? If, of course, there will be a fear of intercourse. I've heard of stories where the lady she's just shivering, she can't even keep her leg. Aside that, for also first timers, you have to always walk through the process. So they don't know nobody knows what to expect with situations like this. And so if patience is not involved, if constant cuddling and petting is not involved, of course the woman is not ready. She doesn't know what is going to happen to her. So, and of course she's scared. Stress. When a woman is stressed out, her whole muscles is tensed up. So the pelvic floor is not excluded, because there's also a muscle at the pelvic floor. This is just to mention a few. I'm sure if you go through books or internet, you will find even more things that I probably have not mentioned. And this is not also to say you should ignore your doctors. You analyze yourself using these criteria. If you notice you have any of the mentioned symptoms or signs, it's good to actually seek further help. The first things first is to go to a hospital where you'll be asked to do a urine culture, high vaginal swab, or an endocervical swab. The results will be given back to you and analyzed, and treatment will be given for the appropriate infections you might have. For the endometriosis, the ovarian cyst, the uterine fibroid, all these are all manageable cases. They are not things that you say, oh, okay, it cannot be treated. There is nothing like that. At least one thing I always believe is that go to the hospital first. Let the diagnosis be made. Then you can take it from there, because you will always have options on what to do. For the psychological cases, a psychotherapy, we cannot undermine the effects of that, because I believe that at some point in everyone's life, we all need someone to talk to. And if you get the right advice or the right help, the right counsel, you would be able to pull through whatever it is. For those that maybe it might just be the whole foreplay and the whole thing, you could see there are sex therapists. Funny enough, yes, there are. Yes, sex therapists. They can advise you on, find out your trigger sensors, what can help you relax and all of that. Those that experience dryness, for their lubricants, you shouldn't be shy about these things. Painful sex is not a shameful thing. It's something that happens to all women at some point. The most important thing there is that you seek help. If you notice you have pain, sex is not supposed to be painful at any point. When you get to the hospital, you just feel relaxed. Nobody's judging you. Everybody wants your well-being. Just stick to your treatment. To the men, please, when the women are having this phase, try as much as possible to be patient, because it is not a permanent thing. It's something that can be managed. You could do sexual or sensual massages, a lot of foreplay while she's going through whatever she's going through. Once she's out of it, if she's your wife, you have her for the rest of your life. So hey, there is no hurry. Take care and stay safe. Bye.
So thank you very much for educating us. We are very grateful and hope to have you some other time. Thank you so much.
You're welcome.